Tickling your baby's head, what does it actually mean? So tickling your baby's head can either be intentional or unintentional. So as part of any vaginal internal examination, your midwife or your obstetric doctor will be feeling for what presenting part is there. Is it a head, for example? Is it alternatively a hand or a foot or a bum, for example? And when this examination is happening to find out maybe how dilated your cervix might be, or to check that baby is okay, or to check if there's a bag of waters there, as part of that examination, they will be touching whatever is in the pelvis at that stage, whether that's a head, a bum, a foot, or anything else. So unintentionally, you are technically tickling that baby's head because you are feeling and just confirming what you are feeling and making sure that it is definitely a head. And often the communication that is relayed from the healthcare professional to the woman or person that's having that examination is just relaying, yes, I can definitely feel your baby's head in the pelvis and on internal examination. If there's a bag of waters that's sat in front of baby's head, they'll be saying, I can feel a big bag of waters in front of your baby's head. However, the term tickling your baby's head is sometimes an intentional intervention to check that your baby is happy and okay. This requires your consent ahead of time to perform. So this is known as fetal scalp stimulation. The evidence for it is quite low quality, but it's to try and reduce the amount of fetal blood samples. This is where if you had concerns with your baby's heart rate in labour, there would be a scratch taken from your baby and a sample of blood taken to process to check how well oxygenated they were during that labour and birth process. Lots of units have come away from that because one, it's invasive, it's costly, it doesn't really reduce the chance of caesarean birth overall, and there are risks to it. And whilst fetal scalp stimulation is low quality in terms of reducing the chance of things like caesarean birth, for example, women accept it better than fetal blood sample. The risks are far lower as well. And from a physiology perspective, when you examine, babies' heart rates normally accelerate. If they accelerate, they can move, they're kicking, they've got enough reserves, they've got enough energy to be able to increase their heart rate, that acceleration. An acceleration on a heart rate trace is a really reassuring sign that your baby is well enough and is getting enough oxygen to be able to move, to be able to increase its heart rate. The chances of baby having low oxygen levels if their heart rate goes up after that tickling of their baby's head, that fetal scalp stimulation, is much lower. And so by doing that fetal scalp stimulation, if there's an increase in the heart rate, that tells healthcare professionals that your baby has got enough reserve, has got enough oxygen, has got enough energy to increase its heart rate. Therefore, the chance of something called hypoxia, which is low oxygen levels in baby, which can have problems for babies, both short and long term, is much lower. And all fetal scalp stimulation is tickling the baby's head, literally with 2 fingers. So as part of that vaginal examination, you'd be examining anyway to see what the progress is, make sure that there's no cord, for example. And that fetal scalp stimulation just helps to reassure and confirm in the rest of the clinical picture that your baby is doing okay. And if baby's heart rate does not go up, it provides an additional puzzle piece for that discussion of, is this still the safest option? Is this still the safest route for both mum and baby to go through where we are continuing this labour and birth? What is the rest of the clinical picture? Do we need to offer any intervention? Do we need to offer any assistance to help baby out in some way, shape or form? Both physiological CTG interpretation guidelines and NICE guidelines recommend fetal scalp stimulation if there are concerns with baby's heart rate on that heart rate tracing. So tickling your baby's head can either be accidental as part of any internal examination that happens, or alternatively it can be intentional with your consent about why they recommend tickling your baby's head, what they are looking for and what the plan might be depending on what happens after that tickling of baby's head.